Greetings, Bermuda. My name is Aaron Hill. I'm joined by my brother and good friend, Mr. Ryan Robinson, Perinchief. And as you now know, this is the Bird News COVID-19 special series. Ryan, pleasure to have you back.
Likewise, my brother. So as you all know, this is the Bird News COVID special series, and this is now the third installment. We are testing live today, so bear with us in case of any issues, but we're looking forward to interacting with all of you today.
Thanks, Ryan. So as we begin today, as we're starting off with all our series, we want to extend our sincere condolences to the families of the 6 victims who have fallen ill or sadly passed, rather, as a result of the COVID-19 virus. And we also want to extend our sincere best wishes to those who are still fighting this virus, and give our thanks to the essential workers who are on the front lines protecting us all. Ryan, I know that we've got a bit of background from yesterday's press conference, and I know that there's a lot that we intend to discuss today. So if you want to tell our viewers about that.
Sure, absolutely. So I know that in our last series, we had Mr. Dion Smith from Smith Technologies to come on. The purpose, obviously, of this forum is to have some productive and critical conversation on topics affecting the COVID-19 pandemic and the fallout from it. We hope to provide a place of community discussion so that we can have forward-thinking and progressive solutions. So, Aaron, you attended last night's press conference for the second time. You asked some pretty powerful questions, but I think the highlight of the night in general was the announcement that we'll soon be coming out of the shelter-in-place emergency regulations and going into a phased approach for the foreseeable future. So we hope to discuss some of the things that you asked last night, as well as the government's response and sort of how people are feeling now that we're so slowly transitioning from one phase to the next. Now, I know that we have an esteemed panel of medical professionals backstage today that we're eager to get on, and we're eager to have them. We do have certain guests that come on the show from time to time, and we're grateful to be in the company today of Dr. Henry Dowling, who's the head of the Bermuda Medical Doctors Association, and Dr. Ronda James, who's a dentist in private practice. So we're eager to have them on screen, and we look forward to asking them questions as well as interacting with the community. Dr. James, Dr. Dowling, how are you doing today? Can you hear us okay?
Yes, great. Thanks for having us.
Okay,
Thank you.
great.
So, Ryan, I don't know if you want to get started. And I mean, I think it's just appropriate at this time, before we get into interviewing the doctors, to just give a bit of a background on where we are with this COVID-19. So yesterday's press conference confirmed that the official number of confirmed cases on Ireland is 111. And of that figure, we have 48 individuals who have fully recovered, 14 persons who are still currently hospitalized, and 6 individuals, as we know, who have tragically lost their life as a result of it. That leaves 57 active cases. That's the latest information that we, the public, have from the Ministry of Health. And I know that we'll come to discuss those figures in more detail. But Dr. Dolan, starting with you, we just wanted to kind of get your opinion, get your feedback on how you as a medical professional have assess the situation, Bermuda's response, the Ministry of Health's response. Particularly, we know that you're the head of the Bermuda Medical Doctors Association. How has the communication been with respect to doctors and the Ministry of Health so far?
Well, I think the physicians have definitely stepped up to the challenge, and wherever they've asked us to step in, we've made our best attempt to do so. There are a lot of physicians who have been very passionate about trying to work with the government to move this along as fast as possible. There's no easy way to get through a pandemic. We don't have the resources necessary. We don't have the medications to simply give somebody a shot and make this go away. So this isn't something that goes away overnight. It takes a while. We understand that, and we're willing to work with them. And we realize that they're doing the best they can within, the scope of what they do.
I want to harp on something you mentioned briefly just now about not having the necessary resources. Now, we've heard a bit conflicting reports when it comes to that. I think maybe we're more prepared now than we were in the past. Can you speak a little bit to some of those challenges and how you think we've addressed them?
Well, I think essentially it comes down to what type of resources you're referring to. So when it comes to any kind of pandemic, you're talking about, do you have medications to either treat or medications to cure, or do you have the resources to at least help the people who are helping those people who are ill? Now, we're dealing with the virus, so we can't cure it right now. We don't have a vaccine. No one does. The medications to treat are still in very early stages of testing. So right now, even though we might have medications that might work, we are not going to just blatantly give it out to everyone, because there are always the potential of doing more harm than good until you have better research and data to back that up. A lot of people will hear a lot of things on internet, but we have to go by what we know to be fact and data. But the third component of that is trying to make sure that those who are helping others are well protected. And that's where you hear the term, the PPEs, or, the protective equipment that is necessary to give people the opportunity to help people, but not get ill while they're helping people. And that's been the challenge that we've been facing from, I guess, day one up until fairly recently.
Sure. Now, Ryan asked a broad question about the equipment and the preparedness. But I note that just a few days ago, particularly last week, you had a statement in which you were thanking the private sector for their support and coming and making sure that we have the PPE, the personal protective equipment for those who are on the front lines. Can you shed a bit more light about that? I know that there was an emphasis on the private sector. Has there been a balance of response from, again, the Ministry of Health as compared to the private sector?
Yeah, sure, not a problem. I mean, I think definitely the Ministry of Health has definitely stepped up and attempted to get the resources necessary. I think the challenge always comes by the methodology by which any large government works. It's a large body. It has many different components that it has to go through. And when you're trying to do something quickly, sometimes it just doesn't work that way. And when it comes to, from the physician's point of view, when we're wanting to be able to get out there and help the people now, sometimes through whatever reasons, governments just don't work that quickly. Even if they have good intent to do so, their resources are going to be limited because they just don't have that inroads to do that kind of job. They have a certain way they do things, and that's the way they do things. So initially, when we attempted to say, listen, we're willing to help and step up, but these are the equipment that we need, the government put us in the hands of the people who were procuring it with them, which was the hospital. But it was challenging for them to get a hold of the necessary equipment, because like everywhere in the world, there were issues with who do you go to, who do you trust, how do you get the financing together quickly, because Bermuda, I mean, if you think of it, everybody in the world is trying to obtain the exact same thing you are, and they're trying to obtain it in a lot larger bulk. So where you're trying to get 5 or 10,000 pieces, some people are trying to get 300,000 pieces. You're going to get pushed way in the back of the line if you do not act right away. And that was where we had challenges, is that by the time the government signed off on issues where we said we needed this, equipment was gone. So we had, we had choices to make. We had to say, do we wait for them to sign off and say we agree to this, or do we now take a quicker road? And if so, we need another source of financing, and we need another path to access that. And this is where the private sector stepped in and said, listen, we will give you the financing, and we will give you the opportunity to do so. And this is where, we're really eternally grateful. So, and it's not that government didn't want to do it. It's just a matter of they just didn't have the ability to do so.
No, absolutely. And I think that those private sector companies and institutions that got together are to be commended. I think you characterized it as James Bond movie type of activity. And so they are to be credited. Dr. James, we've got you there. Particularly, I know that you're a member of the Bermuda Medical Doctors Association, but also a member of the Bermuda Dentists Association. Can you...
Just the Dental Association.
Can you tell us a bit about your experience? Particularly, it will differ from Dr. Dowling, who is a family physician, and you're a dentist. Can you tell us a bit about how the dentist industry particularly has been affected? I know, for instance, for me, I tried to call my personal dentist, and that office was closed. Has that been across the board? Has there been a limited amount of dentists? And where do individuals who are listening, where do they go if they've got any particular urgent issues?
Yeah, so dentistry's been shut down. We're like the top 5 of at-risk professions. So that puts us at risk and it puts our patients at risk. So a lot of us have pulled together as an association, and we're just trying to find equipment so that we can upgrade our practices to make it COVID safe. So all of us are very, very busy behind the scenes, but seeing patients is a little different. And so interview. So the first thing we do is we ask us a lot of questions to find out where this patient's been, and then find out, what the problem is. It's amazing how often we can kind of put off treatment with medication. So we do that where we can. I have seen a couple patients, but we're really careful. So in the dental environment, what the biggest issue is aerosols. And what that is every time we run our handpiece, every time your hygienist uses that little buzzy thing to clean your teeth, that creates a cloud of spit and bugs and viruses in the room. And so it's containing that cloud that becomes the big issue for us.
Interesting.
And that's so where we can do things where we're not picking up the handpiece. We can do some, patching and little things that are non-invasive. But again, we've had a big challenge in getting PEE so that we can even do basic things. So
I'm glad you mentioned that a bit, because Dr. James, when we look at something like Dr. Dowling's practice, Dr. Dowling, you're a GP. So a lot of doctors, when it comes to general affairs and general matters, have done things like virtual calling and teleconferencing to sort of diagnose and keep up to date with certain patients' ailments. But Dr. James, you're a dentist, and obviously, that's not something that's easy to do remotely, because you require, physical contact in order to do most of your operations. So I'd like both of you, but we can start with you, Dr. James, since we have you already talking. How has this shelter in place affected your practice specifically, and how are medical professionals coping with this?
We're shut down. I do get the phone calls. I did want to go back to teledentistry really briefly though, and that is that it's probably a little bit more, it'll become more common in the future, because we want to be treating healthy patients. So it's going to really require that we interview patients before they come into our office quite thoroughly. So that is going to probably be the future, is that it'll be a little sci-fi and a little bit more technical in our treatment. But obviously it comes a day when we actually have to get our fingers wet, and we will have environments that are safe at that point. You asked me what it's done to the profession. We're shut down. There's
Right. It's just one of those cases where you don't always have an instant solution, right? So the teleconferencing is good in some aspects, but
it's still getting the equipment in. So I can't just open up my doors. I need to make sure that I've got an environment that my hygienist is safe to work in. So that requires, we're all having to make capital investments in order to create the kind of environment that's going to be safe for our patients and our staff.
So is this something where dentists are partnering up and collaborating on? Like, what are some of the ideas that you think? You've mentioned that you may have to do teledentistry. Are there some other things that people can expect to see for the short and long term for the future?
Absolutely. You probably won't have a waiting room. People may even wait in their car, and we'll call them in. There are some. We, as an association, we have, we're communicating all the time with each other and giving each other ideas, because there's so much information out there, and there's so many companies that provide these kinds of equipment. So, it's, kind of weeding through all of this and trying to figure out what's going to be the best. And, we're also in a time in which everybody is, there are people out there that could be taking advantage. And so, you're weary of that as well. So yeah, we are all working together. We're communicating with each other. We're trying to get PPE, just basic PPE. But there's other equipment that you can have, like hoods that you can work over, so
Right.
that, the aerosols aren't going into the room. There are different kinds of evacuation systems, and some people are talking about setting up negative pressure rooms, which is
Right.
another idea.
Okay, well, I guess we sort of, it's one of those things we have to wait and see, because you have to weigh up a variety of factors, right? The economics, the finances. Dr. Dowling, can you talk to us a bit? I know we have some questions coming in from some of the live viewers, which we'd like to ask you in a second as they arise. But Dr. Dowling, can you speak a bit on how the doctors and the general practitioners, how are you all shifting and coping? And what does the future look like for medical practice for the foreseeable future over the next few months?
Well, definitely, it depends on what kind of physician you are. So if you're a primary care physician like myself, a family doctor or a GP, you've either stopped seeing patients on a personal level and you're doing mostly telemedicine. Some of them are still seeing patients, but they're spreading them out so that they're only doing them one at a time with, like Dr. James said, nobody in the waiting room. Some of them very initially were doing just, seeing them outdoors underneath tents where there were, good airflow, where everybody was hooded up. This is going to be a new reality for a while, and trying to understand our new place in it is going to be, it's going to take a little bit of time to sort out how we're going to do this, especially since the premier has talked about doing a rolling, opening, where do we fit into that? And how do we just start this up? How do we do that and still keep ourselves protected, keep our staff protected? Some of us have to let our staffs go, and, bringing them back in is going to be a challenge. So everybody's got unique, different concerns, especially if you're a surgeon. You haven't been able to do any surgery whatsoever. Everything has just been emergency only. So it's definitely a challenge, to say the least.
That's particularly interesting. And just peeling back there to Dr. James, I know that you're saying that the dentists are having to make capital investments, and you're not working right now. And I know many people tend to have this belief that doctors have bottomless pockets, but they don't. And so the reality is, you're not in a situation, for example, like for example, if Dr. Dowling has to lay off some staff, or any doctor for that matter has to lay off staff, there's a mechanism for where the government have set up unemployment benefits. But what is really the thinking amongst the doctors in particular? We'll go back to you, Dr. Dowling, but you, Dr. James, with respect to dentists, how are you going to cope? How are you going to manage these things? Have you sought support from the banking institution here? If so, what has that support, or what have the feedback been from them? But yeah, I'm particularly interested to know, how are you going to manage with this? Because it's not a situation where you do have endless resources.
Right. Yeah, I have had to take out a loan, and just to survive. But then I'm also using that for capital as well. So it's it's a difficult time. It's incredible. And I think about myself as having, a profession, a career that I can go back to. And I hope to bring my staff off of furlough at some point. And I worry about, there are so many of us who don't even have that kind of resource. And I worry about the whole island, actually, because there are a lot of us who need help. And
Absolutely.
Yeah. Absolutely. And then you've also got, so we're making all this capital investment. That means that when we go back to work, my fees have somehow got to pay for what we've just come through. But then I've also got patients who haven't been working. And so it's a real concern, just from my own economics, but from other people's economics, and not having, care that we normally provide on a regular basis just to make sure everybody's in check, having such a long pause between their care, I'm worried about what condition they're going to be in when I see them again. And that's why I'm constantly telling my patients, please, brush, floss.
No, absolutely.
Yeah, and I'm glad you mentioned that the fact that you as doctors have had to sort of come out of pocket already. Not only have you had to worry about staff and furloughing persons because you're not practicing in the meantime, but it's interesting to think that even the higher up professions, or doctors, lawyers, those big professions have also started to take out loans and consider how they can make ends meet because of the changes that will need to be made. Now, Dr. James, you mentioned PPE and other sort of requirements that are going to be needed in order to practice safely. We had a question from one of the live viewers, Keontae Roberts, who says, will you not see essential workers since they're at a higher risk of exposure? I mean, you mentioned having to do teleconferencing and things to determine the risk before you see a patient, but our essential workers, the people in the grocery stores, the people who are working at the hospital, they need dentists and doctors too. So, Dr. Dowling, Dr. James, we can start with you, Dr. James. What are you thinking? How are you going to deal with essential workers?
So I think we just need to screen better. If we've got all the right gear on, and if a person is not showing signs and symptoms, they could still be infected. But the amount of infection that they're putting out is going to be much smaller rate. Correct me if I'm wrong on this, Dr. Dowling. So if we're protecting ourselves, we're protecting the environment, we're protecting our patient, the one before and the one after, we should be okay. And there should be no reason. But part of that is, very thorough interviews, testing. One of the things that we're looking forward to is having tests that are a little bit more readily available, and I think that's kind of a long-term proposition. I think it's you have to pick and be careful to let into that environment, and if you're showing any signs and symptoms, you reschedule. But I don't think that there's any reason for us to not see somebody who is not showing any symptoms. And I mean, I think that's going to be the criteria too. I mean, you're going to walk in the office, your temperature is going to be taken. We might even take oxygen, blood pressure, which is, should be done anyway, and just make sure that the person's healthy. And if they're not, we might have to reschedule.
Sure. Dr. Dowling, I think this is a nice transition, particularly when we're talking about, the reduction in staff that have to be made, the reduction in income that is a necessity or necessarily follows rather from a consequence of, for instance, shelter in place or restrictions even after that shelter in place is lifted. Particularly, you've had some comments in your capacity as the head of the BMDA with respect to this proposed health plan pre-COVID-19. And there were some issues that you had outlined. And that was when we weren't facing a pandemic. Now we have niche, bespoke issues that relate to this pandemic that have caused everything to be up in the air. What effect does that have on your perspective on the proposed health plan? Has there been any feedback from the government, particularly the Ministry of Health, with respect to how they intend to transition? Because there was not an ultimatum rather, but I know that you had some issues with respect to consultation, but there was an indication rather that this proposed health plan was going to be implemented in due course. Has there been any indication thus far since COVID-19 as to what the government plans to do?
No, not at all. I think the government has been completely overwhelmed by this pandemic to be worried about, implementing a completely new healthcare system that was already potentially had its challenges. Has my thought process changed? No, not at all. In fact, I think if for no other reason, this is going to put more of a challenge on the government trying to implement a government-run system. You have you're asking a financing of a system from now a government whose financial coffers are not only empty, but are going to be looking to others to help fill it up. There's no way in the world that we're going to be able to pay for a healthcare system right now out of public funds. There's just no way. We're going to have to go back towards looking at what we originally proposed, which was making the private healthcare system work better for the people of Bermuda, and making them step up and do their job better.
And I think that's a great transition into the question of what are the insurers doing with respect to the doctors now? Have they stepped in to say, hey, listen, we understand that claims are not going to be made, or they're going to be, have they indicated that they're going to be backlogged? Because I know even the insurers are working from home, if you will. Have they lent any support or any guidance or any indication rather as to how they intend to? Dr. James has just outlined, the financial strengths that have been placed on practices, not only just in dentistry, but you will know, Dr. Dowling, in general practice. Have you had any discussions or dialogue with the insurance companies?
Well, they were at least willing to help with the fact that we had to either lay off or reduce staff. They were willing to defer health insurance premiums that we had to pay out for this time period. And when it came time to help pay for telemedicine, they worked with both ourselves and the Health Council to make that a reality. Up until this point, there was no such thing as getting paid for telemedicine. There wasn't anything in Bermuda like that. And now, rapidly, that has been transitioned into a reality. Whether that becomes a permanent structure or not, we'll see. But at least they stepped up and were willing to fill in that gap. Now, I don't think necessarily they're going to lose from it because, in general, their payouts are going to be tremendously low. If you think right now, there's no way that we're sending that many people away. There's no way that many people are getting that much health care being reimbursed by insurance under this circumstance than under the other one. But they're still obligated to pay some form of premium. So, I think we're all paying into this current dilemma one way or the other, including the insurance companies.
Right. Now, Dr. Dowling, in answering Aaron's question about the government's intended healthcare reforms, you said that the healthcare system already had its challenges and they're only going to get a bit worse now. Can you speak a little bit to what those challenges were and how this current pandemic crisis, I know you mentioned a bit about the costs and government's coffers being empty, but I want you to talk a little bit about what are some of those challenges that we had before. Some people maybe didn't have insurance. Some people already had issues accessing healthcare at an affordable rate. What sorts of things do we need to be thinking about now, and how do we sort of incorporate those prior challenges in our response moving forward?
Well, I mean, I think the definition of an affordable rate has always been a challenge. As I went and bought a $8 bag of sugar, yesterday, and Dr. James is talking about it. She's going to have to invest in her practice. So nothing is quote unquote affordable in a isolated island as Bermuda. We know things are going to be very expensive, including healthcare. So that's a given. Now, what we're trying to do, however, is saying even with things being expensive, can we find a way to keep people healthy and not have them go broke doing it? And I think that's the difference, because right now, if we look at some of the models that go on in other countries, the biggest challenge that ends up forcing governments and countries into the socialized systems and socialized medicine is that people go broke paying for hospitalization and large outlays of, having to put, people into homes and pay money like that, not going to doctor's visits. And this change that is currently happening right now is dealing mostly with trying to fund your doctor's visits and not necessarily the biggest ticket items. And what we were saying is that with all that change, it wasn't actually going to decrease the cost of your healthcare dollars. That $700 and something million at that time was not going to go down after the government took over or changed the scheme. And that's what we were concerned about. We were saying there were ways of actually dropping that dollar value without putting the risk into the government's hands, which means putting it into our hands. Because we don't want to do that for our children. We don't want to make our children have a bigger risk that they have to assume if they don't have to. Because
while we're talking about healthcare plans, we have a question from Anna Pereira. Does this pandemic now increase the standard future health cost for the new plan, since the data and the models now have very different assumptions and actual versus proposed costs? Maybe you could speak to that a bit, whether the cost of future plans will change.
Well, that's going to be that's a good question, because right now a lot of the what our governments have tended to do is put a lot of their resources into the hospital. And so anytime they need something done, they expect the hospital to step up and do it. And the hospital over the last year in this budget were capped. They were given a certain amount of money and expected to do everything in their power within those dollar values. Now, this pandemic has asked the hospital to do more than they would normally be expected to do. So it will be interesting to see if they're going to be allowed to increase that cap, given the cost of what this pandemic has done. And also, if that's the case, if we model out, what the new normal is going to be, given what a pandemic will do 1 year out, 5 years out, it's going to run its course financially and healthcare wise. It's going to raise the cost of healthcare in general. And whether that means it's going to cost more in terms of hospitalization, because, are they going to model at least 5 people per month going to be hospitalized for, COVID related injuries? Are we going to see more people in our offices for that? All of that's going to be, cost more money to somebody, whether that's to private funding or government funding, one way or the other.
So a common theme in our past 2 series that a lot of people seem to be concerned about is the internet and technology. Now, Dr. James, you mentioned a little bit about switching to teledentistry and things like that. Now, I know for a fact that, there have been some innovations lately with sort of robot doctors and, all sorts of different inventions that have allowed the medical practice to be more efficient, more economical, and more innovative. One of our viewers on Facebook has asked, is there more room for innovation in the medical industry? How can IT infrastructure sort of help us, considering the fact that, as we've heard from the Premier and others, this pandemic is not something that's going to end in a week or 2. We're talking about the new normal as far as perhaps the next year, perhaps the next 2 years. So can you speak a little bit about, whether there's more room for innovation in the medical industry and how that might affect costs?
I think there's always more room for innovation. When I started out, we were looking at charts, and now, we have a paperless office, and we're talking about teledentistry, which is, you still, at the end of the day, have to probably do some cutting, but who knows, with research, maybe we'll be able to grow tooth structure. That'd be great. I always believe in the future. Yes, it's going to get better. Cost, will it take the human factor out? It brings cost down. Sometimes it takes cost up, because a job, and sometimes that affects the economy in another way that that you may not. That was sure.
No, I think that's a good point to transition right now into asking you guys your opinion on the phases that the government have released, and particularly how that's going to affect potential influxes in, you've said you've not had patients thus far. I don't think, unfortunately, Dr. James, that changes for you, but maybe Dr. Dowling, you will see an influx of patients as we're now being able to be readily outside, accessing one another, traveling to and fro during the day. Are you at all concerned about the level of interaction? And is it your view as a medical practitioner? For example, let's look at the background of the modeling that the government have given. Worst case scenario of an excess of 700 deaths and a better case scenario of just over 200 deaths. The question was posed to the Premier as to whether or not we could have saved or reduced that number, the potential number, at least for the purposes of the model, by extending the shelter in place. Now, I know everybody wants to get out. I want to get outside. But how do you feel as a medical professional, bearing in mind that model, as to the phasing that the government have just recently announced?
Well, you know, there's a cost to each decision that you make. There's a cost to staying in sheltering in place, and there's a cost to opening your doors.
That's true.
And I think people have to understand that, you know, while we are so fixated on people potentially dying of COVID-19 related deaths, that there are also people who will die and have died from other issues by sheltering in place and not getting access to the other healthcare industries that have been closed down because of the worry of COVID-19. So, you know, we at some point have to balance that out. And, you know, the government statistics don't actually probably represent those deaths that have occurred. You know, myself, I've had quite a few people who have died over this period of time who, although if you swab them, they didn't come up with COVID-19, there might be a case made that would we not have had COVID-19, would they have died during this time due to an easier access to healthcare resources.
I see.
And that's just one practice, and I'm a small practice. So that bars the question of how many more people might have dental issues that might get really infected because they cannot get easy access. How many people might get very ill or things like that. There are other issues that we have to kind of plan out should they not open their doors.
I'm glad that you mentioned that, Dr. Dowling, because we've seen in some countries, for example, there have been some theories and arguments that people were being, you know, diagnosed with having COVID-19 and then passing away. And people were saying that COVID-19 wasn't the actual cause. So some people were saying that the stats were a bit exaggerated. You know, there's all sorts of people having heart attacks and things like that. And if they also tested positive for COVID-19, then that was listed as the cause of death. But what you've just spoken to is sort of the side effect of things like a shelter in place, where you may have people who have certain drug addictions or may have other ailments that are now being impacted by the shelter in place. So, you know, we may be looking at saying, here are the test results. Do we need to stay on lockdown a little bit longer? But what you've mentioned is an interesting point about sort of the hidden cost of things like lockdown procedures. Now, he did also mention, Dr. James, you know, dentistry and sort of how teeth and how that can be an indicator of your overall health. Can you both maybe speak a little bit, a bit more about that? You know, how can extending or ending early this shelter in place have other knockoff effects that people should be thinking about as we weigh up whether government is making the right decision?
Yeah, so for dentistry, I probably the thing that's the most, you know, that pops in my mind the quickest is periodontal disease. It's a high risk with patients who have diabetes and diabetes island. So my diabetic patients, I want to make sure that they're seen regularly by the hygienist. I want to make sure that, you know, they've got the tools and the knowledge to take care of themselves on a daily basis, because they've already got a compromised immune system, and you know, throw another fire, you know, log on the fire, which could be periodontal disease, and that just starts making their diabetes act up worse. And you know, I'm not usually dealing with life and death issues. What I'm dealing with is kind of the keeping the whole person as healthy as we can from the aspect of their oral health, so that when they see the doctor, maybe they can, you know, take a little less medicine and, you know, come up with some other lifestyle that's going to help them to get healthier and healthier. And so my real concern, you know, when my patients don't have the access to their hygienist and to me, is that, you know, I just hope that their numbers are still being maintained and they're being taken care of. And then obviously there's the patient who's in a lot of pain. Often though, pain can sometimes be dealt with kind of teledentistry, but there are certain things that, yeah, they do need a little bit of intervention. So, yeah.
Dr. Dowling?
Yeah, there's no real easy answer to this, and I think it's a fluid situation that has to be constantly monitored, and decisions are going to be made. I often say that everybody's going to put a price tag to somebody's life, and when they say that if you open up, there's a cost to that financially, and there's a cost to that in terms of the number of people that die. And if you keep closed, then the same thing happens. And right now, the government is balancing that out and trying to decide which is the greater good and which is the greater evil. How they're coming up with their numbers, that's a government thing. I wish they had more family doctors on their boards that make these decisions. I think they would get a little bit more holistic approach to it. But nonetheless, they're going to do what they're going to do, and the people have to live and or not live with those decisions. But I think we have to keep them accountable, because you will notice that as time goes on, their vision towards what's important changes over time. So when they first start out, they'll talk about how we don't have any COVID-19 occurring within our community. And then after a while, they stop talking about that. They'll talk about other things because they don't want you to ask those questions, because then you find out you do have community spread. But the important thing is not to necessarily hide things from your community, but to make them aware of everything. We're big people. We can deal with the reality of this situation. I think if everybody has all the information at hand, if you're making a decision based on that information, I think that people will understand and they will support you, but you have to give them all the information.
Absolutely. If I could just jump in right there, you mentioned a little bit about how government is making their decisions. Now, Dr. Dowling, you're the head of the Bermuda Medical Doctors Association.
Mm-hmm.
Are you suggesting, and I think Eron asked a little bit about this earlier, are you suggesting that government should perhaps be collaborating with the doctors a bit more in making these decisions? Has there not been enough consultation perhaps with the other medical professionals outside of, for example, the Department of Health?
Well, I mean, governments can do whatever they want. That's their choice. That's their prerogative. But there's always going to be, the better your ability to get a bigger a buy-in from people who know what's going on in your community, then you are able to make better decisions. And I think not having practicing family docs sitting at your table when you're making these decisions can actually work against you, because you can tend to get tunnel vision. You can start to look at statistics without remembering how those statistics play out in a healthcare situation. And no matter what else you might like to think about this is still a health problem that has economic implications and social implications. So you still need health people at the table. And if you really want to make an impact, you can't start off with your healthcare people that are in the hospital areas without keeping mind of the people that are taking care of your people in the communities. And that's your primary care doctors. So we've said from day one that our governments tend to think of your community doctors as afterthoughts. And we're only asking that you bring us in right at the beginning and you keep us at the table so that we can keep you up to date with what the challenges are going to be with whatever decisions you make. We can't force you to make a different decision, but we just want to make sure that you're aware of the possible implications from a healthcare perspective.
Absolutely.
No, sure. So now as we're winding up, because I know that, not for you, sorry, Dr. James, because you're at home, but Dr. Dowling, I know you're in practice, and we're keeping you from your patients at a time like this when patient care is ever so important. So I know we're going to start to wrap up, but in conclusion, for the both of you, I did want to ask you, starting with you, Dr. Dowling, what effect or what advice would you have for the general public? We've seen instances that right now we're in allergy season. You know, I tend to sometimes have a dry cough. Now that's something that I'm a bit more mindful of, you know, to the extent of possibly holding my breath sometimes for fear of somebody thinking, well, you know, are you okay?
Yeah,
Or, hey,
that's
look,
a new social crime, isn't it? Coughing in public.
particularly now as we're about to lift this shelter in place, we're going to have more human interaction back to community. I don't want to say back to normal, but people are going to be moving to and fro and having access to one another. What advice would you have for the general public as to how to conduct themselves and be mindful? Because I know that, you know, there is a bit of, and I don't want to say it's a hysteria, because in some ways we do have to be cognizant of certain realities. But where do you say that, you know, the balance ought to be struck?
Well, I think you brought up the fact that coughing is not a crime, and going forward, we can't turn it into one. So, everybody who coughs does not have COVID.
Yes.
So we're going to have to kind of understand that as we move back into the social realms. But at the same time, where people used to, you know, want to go back to work regardless of how ill they were, they have to understand now that there's an implication to other people. So if you're ill, you have to stay home. There's no doubt about it. I don't care whether you have COVID or not. You shouldn't. The risk to spreading whatever you have to others is always great. And this is just showing you in very big, bold letters how great it can be. But from the other perspective, you know, in this day and age where we have so much allergies and stuff going on, we have so many people who are willing to cough and stuff rather than take a medicine. But now we have to be a little bit more sensitive to understand that if you're somebody who has allergies and things like that, that you are going to be looked at if you're not treating your allergy symptoms. So if you're somebody with allergies, you might want to start getting a jump on them now as we're moving into allergy season. And whatever you're using to do that, whether it's a prescription, whether it's an over-the-counter medicine, or whether it's something natural that you're using, go ahead and start it now, because like they said, if you're coughing or sneezing in the public eye, you're going to be looked at with quite a interesting.
As I think we've seen. But Dr. James, I know that it's particularly different in the dentist industry, but my final question to you is with respect to, is there any capacity with respect to designating, for example, an area, whether that be at the hospital, whether that be at one of the larger practices, for the dentist community to come together so that we don't start to wind down from the COVID issue and then start to have an island-wide dental issue, or oral issues with respect to our oral health and the like. So what do you think that we can do to overcome the hurdles that we're having, particularly with respect to dental health?
You know, I'm a big girl on preventative, and the more you do for yourself, the healthier you're going to be, and that is across the board. It doesn't matter, you know, if it's a or if it's a body problem. And in a way, I kind of see this COVID call for some of us. It was definitely for me, to that, you know, we need to. It's just going to take a while for dentistry to re-kickstart and find. But, you know, the more you can do for your health, whether it's, you know, exercise, and there was a wonderful video that the physical therapist did. And I was thinking about all those people who were thinking, yeah, I've got time, I'm going to exercise now. And then they strain something. And it was a really good reminder that, you know, moderation, but, you know, let's get better. Let's get healthy.
Yeah. Ryan, really briefly, and I'm glad I'm not at the press conference because I wouldn't be able to ask another question after I said it's my final one. But Dr. Dowling, specifically as it relates to the BMDA, is it a situation where the BMDA have reached out to the government and haven't been met with a response? Or is it simply, you know, that you feel that it's the government's duty to reach out to the BMDA or specifically family practitioners?
Oh, no. I mean, we're always open to talking with the government. I mean, there are a lot of BMDA members who have availed themselves of their time And we appreciate them stepping in and helping out any and everywhere that they can. I think this comes down more so to helping out with policy issues, because, you know, we're all going to be in this together. And as, you know, Dr. James has said, we're all suffering through this together. There's no one person, I don't care how financially successful you might be, you're going to get touched by this. And we all going to have to pick up and help each other out in the long run. And we're willing to take our share in this, but we want to make sure that we understand that, you know, we're the worker bees here. So we want to make sure that no matter what's coming from the top has to understand how it actually will play out in these offices. So, you know, whatever you think will happen when you write that paper in the parliament, in this office here is where it will either fail or succeed. And if you listen to us, it's going to fail.
Thank you very much. So that was Dr. Henry Dowling, head of the Bermuda Medical Doctors Association. And we also have the pleasure of speaking with Dr. Ronda James, who's a dentist in private practice and a member of the Bermuda Dental Association. So we're going to let you get back to your patients and your work. We know that you're very especially busy during these unprecedented times, but we definitely like to thank you for taking the time out to have a quick conversation with us today. So thank you very much, and we look forward to following the discussion and continuing based off of what you've presented to us.
Thank you.
Thank you.
So, Eron, I mean, it was definitely a great bonus to have those two doctors on. I saw some comments on mental health from some of the live commenters, and I just like to let those viewers know that whilst we were grateful to have Dr. James and Dr. Dowling here today, we'll also be doing more segments, and we felt that mental health was something that was so stigmatized that we'd like to have a special addition towards that. So definitely stay tuned. Now, for the rest of this press conference, for this series, we'd like to talk a bit about the press conference from last night. Aaron Hill, you've been attending those press conferences as of this week. We'd like to pick apart a little bit about the government response and shift to some of the other issues that were happening. Now, one of the things that Dr. Dowling mentioned, which I thought was important, was the need for government to collaborate. And he mentioned something just before he exited and went backstage, to the effect of, you know, whatever legislation or whatever decisions you make up there in the big house in Parliament, at the end of the day, when it comes down to his practice or you know, anybody's practice, it has to match up with the reality on the ground. And we heard Premier Burt on one occasion mention that there were decisions that he made where he realized later, you know, it didn't match with the situation on the ground. So I'm wondering, Aaron, you know, you were there on the ground at the press conference last night, as well as on Monday. Let's talk about some of the questions you asked and how they match up with what we've heard today.
Yeah, I think it would be appropriate to start with what they announced, what the government announced, and that's the staged or phased approach. As we reach this coming Saturday, we're going to be in phase one. The government have made it abundantly clear that there are no timescales attached to these phases. And I think that's with good reason. I think that for our listening audience, that means that you and I have a responsibility to ensure that we are abiding by the rules. We are maintaining social distancing, the strict measures, notwithstanding the fact that we're able to interact during the day. Now, one of the questions, particularly with respect to interaction during the day, is I asked the Premier, what was the scientific or social data or science behind a decision to allow us to interact freely without any lawful prohibition during the day, during the working hours, and then during the nighttime we have this shutdown? And is there any rationale behind that decision as to why we're at home? And I think he made a good point. He was fairly quick on his feet about it. So I think that this is something that the government was certain about, that, hey, look, you've got parties that happen during the evening time. By shutting it down at 10, we're going to be restricting that activity, the general activity that would be happening. We want to make abundantly clear, and this is what the Premier is saying, that with respect to phase one, this is not an instance where we're now back to normal. We're very much still in the stage where we're trying to see, okay, well, what actually is going to happen when we start to interact as we did pre-COVID-19. So from my personal opinion, I totally understand the rationale. I think a lot of us will be disappointed to know that we're still in this state where everything's shut down. You know, we've got these restrictions. I mean, curfew is something that's unheard of for this generation, unless it was parental enforced But now we're seeing an island-wide effort that's going to be necessary in order for us to move throughout the stages. So I would just take this opportunity, and I know you'll support me, Ryan, in encouraging all of us to abide by those regulations that are in place, and so that we can go through these phases and go to what that new normal is, whatever that may really mean and how long that takes.
What I think it might be is it's a case of reality setting in, isn't it? You know, when we first had this outbreak and this pandemic, 2 months ago, there was a little bit of panic, you know, once we started to see an uptick in cases, and everybody said, you know, the airports, why isn't government doing more? We need to just stop everything. But I think now, as we're realizing, as global developments have formed, is that this is not something that's just going to pass a week where we shut down and we take a pause and then everything goes back to normal. We just have to stay home for a little while. This is the reality for the foreseeable future, perhaps the next year, perhaps the next 2 years. So it seems to me that government's response is one where they're trying to be practical. I mean, we've been in a shelter in place for just a few weeks now, and there's already been over $8 million paid out in unemployment benefits. We've seen deferments on mortgages. We've seen economies crash entirely. And I don't think that it will be practical to expect that we remained in a state like this for months and months and months. We have to sort of balance the two. We also saw Dr. Dowling, who spoke a little bit about the hidden cost of shelter in place, which is you have mental health issues, you have people who are addicted to drugs, you have other things that need to be met, and other people who are going to suffer by being forced to shelter in place. So I think this approach by government, is it the right one? Well, I don't know if there is a right one, but it does seem that they're trying to strike a balance between sheltering in place and saving lives from COVID without having it dramatically interrupt the lives of everybody else who's healthy.
Sure. Do you agree with the curfew personally?
Personally, I'm not sure, you know, because in my mind, if I'm out and I'm traveling about during the day and I'm running around doing my grocery shopping and running errands because I know I can't get things done, you know, at night, or I can't go anywhere, it may seem like it defeats the purpose. I know that you asked a question last night. What is the impact of a curfew? You know, because if people are going out, they're going to go out. What actually happens where government needs to justify that? And it was explained a bit that there was evidence to support the fact that having a curfew reduces activity. Well, of course, it reduces activity.
We didn't hear what that evidence was. I mean, it was really, I mean, if you go back to the video, it was at the end of the question, almost seamlessly, the premier had his response that, well, you know, if we shut it down, the clubs and the parties and the like, but is there any specific evidence to that effect? Particularly when there's no restriction on me going to somebody else's house. You know, I can go and liaise throughout the day and have, you know, a plethora of traffic, particularly in circumstances where we've been restricted to our homes for a month. We are eager to get outside. I've been blessed to be able to attend the press conferences, which for in addition to the responsibility that I have to ask questions, has been, you know, a huge mental relief to just ride down the road, down the
exactly.
get out of the house. So I know that even if individuals don't have something particular to do, they're just going to get out of the house. You have students who have returned home who want to see their friends. And so, you know, there's not a criticism, they're just questions to really, and I guess what the government's really saying is we'll be able to properly analyze whether this phase one is the correct role, you know.
Right. I mean, I think the problem is that when you ask a question like that and you don't receive a sufficient answer, the only thing you're left to do is to speculate, right? And the only thing I can speculate is sort of what the premier stated, which was, well, obviously, if you're implementing a curfew from 10 p.m., then they're not going to be house parties and things like that. And you know, if you reduce activity, then you'll reduce the rate of transmission. Well, that doesn't really depend on any particular time of day. It's just natural that if I'm restricting somebody from moving or doing any particular activity, then I'm also restricting them from spreading a virus to people who are outside of their household. Now, why that curfew had to be implemented at nighttime as opposed to, for example, us living nocturnal lives, you know, it just seems to be a bit arbitrary. So, I mean, I can see the logic that we want to remind people that we're not in normal times. So we're going to implement a curfew just to reduce activity and keep people, you know, subconsciously thinking, hey, this isn't normal. This is a phased approach. We're not going to just have everything open back up. But at the same time, I would like to see a lot more evidence when some of these decisions are made, considering what you said, people are severely impacted. You know, not everybody operates from a morning to night schedule. So we do have to continue to think about those types of things.
And I mean, particularly the phase one sees parks and beaches. Now, I haven't been able to go for the runs on the railway trail during this period, so I'm not complaining about it. But it is curious that we don't have any restrictions when it comes to beach, particularly when we're coming into our summer months. And so it would be good to understand. And I mean, I know that we're requesting individuals to remain 6 feet apart, but nobody's walking around with a 6 feet ruler saying, okay, this is officially 6 feet. And what is a safe distance? You know, when you're swimming in the water, what additional? And so I think that what we would like to see from a public perspective, and I think a lot of people right now will just be saying, Aaron, be quiet. We want to get outside on Saturday. But there are also other people who have told me, well, I'm not going outside immediately because I think that's going to be that second wave. So you've got two minds within the community there. And I think it's really just going to be interesting. And I think the overriding point and objective that I think the Premier tried to make clear, and I think he did make clear, is that we have a collective responsibility. So yes, we can question whether or not it makes sense to be at the beaches. But realistically, if we're going to be at the beaches, let's remain in a safe distance to do so. And I think that's what he was saying. So I think there's a balance to be struck in an understanding that.
You're right. I mean, but mind you, on that point, my biggest concern, I guess, is if we're restricting everybody's activities to a set time in the day, you're going to have a lot of people who are going to rush out and try and get things done. We saw that a little bit with the staggered approach they were taking to, for example, hardware stores opening. I believe, if I'm not mistaken, they only allowed them to be open on Mondays and Wednesdays, Monday through Wednesday, and then you still had to go on your designated day. So I was speaking to a family member today, for example, who said, well, you know, I had 4 or 5 different hardware stores I needed to get to, and I was only able to get to 1 or 2 because I was rushing around trying to get everything done on my day. And so I think, you know, tying in with what Dr. Dowling said about having the legislation match the reality of the situation, we have to be a bit more practical, and where we can't foresee everything, that's exactly where we need the community to come in. One more thing I will say is, you know, I was at the grocery store on my particular day, and there was a senior who came, and she came and she was struggling to walk, right? And I just said, you want to go in front of me? You know, and she said, okay, sure. Now, I reminded her that there's a special seniors day at the time. And I said, did you know that seniors can go and get their own groceries on Sunday? You know, you have a designated day. And she said, yes, but I had to get my son to drive me, and he's only available during the weekdays. So that was a perfect example where government has implemented something with a particular group in mind, but it's not matching the reality for example, a lot of seniors who, as Keontae Roberts is saying in our Facebook chat, had to wait in line at the bank and then go and do their grocery shopping and then go and do something else. So I definitely take your point there. And I think it's key that we have to just be mindful that, you know, nothing's going to be perfect. There's always going to be complaints, but we have to communicate with the people. And when we don't have the right answer, we have to just be honest and let them know.
Yeah, I think shifting to another one of the questions that was asked of the Premier, it was, he made a comment or statement rather in the previous press conferences where he gave, I wouldn't say an undertaking, but he indicated rather that legislation would be forthcoming that would give Parliament the power, our elected officials, the government, the power to declare a state of emergency, that we wouldn't have to use the government. So although the governor rather. So
right, to declare a state of emergency.
Now, as an individual, you know, who is a proponent of, for instance, independence, I thought that there was a move there from the Premier to say, okay, well, we're going to make staged approaches. You know, we've seen he's answered and said we didn't get any financial relief. And, you know, his statement in respect of whether Bermuda has accepted any financial relief was, we've never done that before, and I'm not going to start now. And so I was hopeful that when I asked him the question about why this decision was made, we would get sort of an indication, for example, from the Premier that, hey, we want to move away from this process where we've got to ask somebody else who isn't actively involved in the affairs per se for permission to declare a shelter in place. Right. I know that you, Ryan, have a different view about taking or being able to implement a state of emergency in those circumstances.
I mean, I know that the basis for your question was that you asked whether there had been any issues, for example, in getting legislation passed with the governor there. For the benefit of our viewers, just so we can, I think it would be good to give some background. As many people will know, we're currently in a state of emergency. Part of that state of emergency has been incorporating shelter-in-place regulations, which forced us to stay on lockdown. But in order to declare a quote-unquote state of emergency, the governor has to approve, and that legislation has to go through him. Now, the Premier Bryant has indicated that the government intends to pass legislation which will have the same effect or allow government to respond to a pandemic without having to declare a state of emergency. Now, Aaron, you asked a question last night asking, why did government feel the need to pass laws which would have the effect of taking away certain constitutional rights without having to declare a state of emergency? And I think it's an important thing to think about, because while we're dealing with the health issues and survival mode and all those types of things, there are a lot of people who are concerned about our constitutional rights, the nature of the state. So
I think that one thing that's missing from that question is the context of the proceeding. It was a double question in the sense that I asked him, has the governor interfered, or has the governor's role, had any effect on the government's ability to make the decision? And the answer was an unresounding, unequivocal no. And so on that basis, I thought,
why do you need to change anything? Exactly.
I thought definitely here's a move that's being made here, a tactical one, so to speak, of utilizing this as an opportunity to say, hey, look, we haven't had to do this in our recent history. Now that we have, we think that the need to consult the governor is unnecessary. Let's do away with that. And that didn't seem to be forthcoming from the response from him. It was merely, that was a decision that was made by the cabinet, that it would be easier in those circumstances. So notwithstanding that decisions are made, I think that it's important to analyze the rationale underpinning them, because I was hopeful, for example, and I know many other people were looking at that and saying, well, look, we're getting rid of the need slowly but surely for the necessity of having a governor and making steps to that I word that a lot of people don't like to talk about, is independence. Because in circumstances where he can confirm, or the premier can confirm rather, that we haven't received any financial assistance from the United Kingdom, it really begs the question in these circumstances. I know that we've got relief, but he wasn't able to answer whether or not we've paid for that relief. And if we have paid for that relief, really we fended for ourselves.
No, I'm not sure how much that actually factored into the decision, because you'll note that when you did ask that question, his response at the tail end of it was that having Bermuda in a state of emergency has a sort of psychological effect on the people. People get anxious. If there's something to be said about just knowing we are in a state of emergency, and that he wanted to avoid that, at least, or he alluded to at least trying to sort of normalize the situation. I'm not sure if I completely agree with that. Should we be feeling like this is normal for us versus being in a state of emergency? I mean, for me, if constitutional rights.
Let's just get some clarity there. You don't agree with what?
I'm not sure if I agree with passing legislation which allows us to do certain things that normally would only be done during conditions of a state of emergency. So, for example,
well, go ahead. Let me let you finish your thoughts.
So, for example, if constitutional rights under a shelter-in-place regulation have been restricted, right, because we're in a state of emergency, and now you go and pass a law where we can do those same things, we can prohibit movement, we can implement a curfew, for example, without having to declare a state of emergency and suspend the Constitution. To me, that means that we have to that we're sort of accepting that it is normal for government to take certain actions which otherwise would only be done when we are in a crisis mode. So what I got from the response from the premier was that even though we're still in a crisis, we're going to enact laws which allow us to not be in crisis mode. Whereas this is no longer a state of emergency. It's no longer an urgent situation where we need to take away constitutional rights. This is just something we can do on a normal basis.
To the premier's defense in that regard, I think actually what he was saying was we've provisionally, prospectively envisaged that we're in a state of emergency until the 30th of June. If we want to make a decision to change that, we've got to go to the governor. And if circumstances arise to reinstate that state of emergency, we've got to go back to the governor. So,
but the premier said he didn't have any issues, right? He didn't have any.
Hold on a minute. Mm-hmm. I think that when you really look at it in the circumstances, you remember that effectively what they would be doing is making constitutional amendments, right? And when you look at, as you will know, any constitutional amendment, there are certain legal procedures in Parliament that have to give effect to that. So it's not a situation where this government can really has the power within itself to or to automatically change these constitutional provisions. It would need the assistance of the opposition in that regard, because there's a certain percentage of votes in Parliament that you need when you're amending constitutional provision. So I think the concern that we're going to automatically go to Parliament and amend a constitutional provision as important as this, one, it would have to be sure not to offend any other existing constitutional provisions that it was seeking to amend, other than having to approach the governor, because there's still other rights in place. So it's not really, there are also mechanisms that Parliament would have to put in place as to how that procedure would work. So it's not a situation where I think it's a bit premature to say, well, legislation isn't good if we haven't seen that legislation to say what it looks like.
Yeah, I mean, I understand what you're saying, but it seems like we're in a common scenario that we often face in Bermuda, which is trying to have our cake and eat it too. I mean, if we're currently enacting regulations and rules which require the consent of the governor in order to declare a state of emergency. Now, the premier in your question last night acknowledged, hey, we haven't had any challenges with actually going to the governor. So it's not as if you can say, hey, we're having trouble responding to this crisis effectively, and therefore we need to cut one person out of the equation. That hasn't been the case. The premier has indicated we haven't had any issues. Now, the UK hasn't necessarily provided any support, but they haven't also impugned or infringed anything upon us either. So if we're now moving to a situation where we're changing laws which have constitutional effects, but we're not actually changing the Constitution, then my issue is that we're not allowing the proper discussion to take place around it. And before you know it, we're in a situation where we've now reneged on all sorts of constitutional arrangements and changed and tricked and tinkered with everything, but we haven't actually had the productive conversation to surround it. And I think that was something that the opposition mentioned when the premier was tabling in the virtual House of Assembly, as far as passing laws without, in that particular case, when the House last met, the premier wanted to extend the state of emergency up until June, and because they have the majority in the House, they got that. But the opposition was advocating, instead of extending this state of emergency up until the end of June, let's review it every 2 weeks. The premier had the power to say, no, we're not going to do that. We're just going to extend it because we're going to need it anyway. Now, the side effect of that, although it allows the government to be a bit more flexible, is that we haven't had another sitting of the House of Assembly where we've actually been able to discuss. The opposition have not been able to ask those questions in the parliamentary forum. And so my overall issue is that the government in this particular case is trying to have its cake and eat it too, because we're making all sorts of constitutional changes without actually doing what needs to be done, which is have a full-fledged conversation around it.
No, I appreciate the concerns that you're making. I think that they're legitimate concerns, but they're a bit hypothetical in the absence of any document, because the premier has made a number of statements where he said, we're going to do this. But then there's consultation that takes place. For example, and I just put a pin in it, my question with respect to whether or not, because of the state of the economy and the reality post-COVID-19, we're going to see ourselves, fast-tracking cannabis legislation that potentially has the effect of boosting our tourism back to where we need to be. And the premier said, well, things that were necessarily on the front burner before may not be now. And that's different from the preceding question where he said that we're going to have to do things differently in the economy and drastic legislative changes are going to have to come. So I think he's in a bit of a bind and under a lot of pressure and asking a question off of the cuff saying, hey, well, Premier, what do you plan to do here? He doesn't want to overspeak, but at the same time, he's trying to impart that confidence rather in the people of Bermuda by saying, hey, we're going to take these actions. Now, I do agree with you when you say that these statements should not be made if the government even isn't serious about making it. I know that he made a comment that the AG's chambers has been inundated with respect to COVID-19. Well, I think that the AG's chambers, like any other department or institution, has been working from home. They would still be expected to maintain within reason the same workload. And I think that these legislation can happen. Perhaps what he was saying is we can't work on the cannabis legislation because we're working on the legislation to change the Constitution, but he didn't exactly say that. So
right.
From the Premier's perspective, I think that he ought to consider not making statements, even if it is to placate supporters, if you will, and conjure up the support of, okay, well, we're going to do these things because they know that the base supports this
Absolutely.
anti-establishment,
I mean,
anti-colonialism.
people are
But
paying attention, right? You know, people are going to listen and question. And when they don't get answers on that initial statement you make, it's going to raise only more questions.
Absolutely.
Now, before you segue into the next point you were going to make, I just want to acknowledge some of our viewers. Geography 09 on YouTube said, let's prepare ourselves for a new paradigm as we make moves to getting Bermuda operational. He had mentioned something earlier which had the effect of saying that it's for the people to decide what becomes normal and what isn't normal. And so I think that's the point we were both making when it comes to having the actual productive discussion surrounding it. Now, Sally De Silva said she agrees with you. We need the governor's okay, and that things might get a bit messy if government were allowed to make.
Well, that's not exactly what I said. No.
I don't think you said that either, but I'm giving you credit that she agrees with you in some respects, because Lyndon Jackson right after that said that he agrees with me, and he said that we need to be careful around surrounding what we embrace under these conditions, and who defines what the new norm is something that we all need to consider. And so I think that as long as we have our debates and we have our disagreements, right? But as long as the public are aware of these considerations and they're asking these questions, then we've done our job. Olivia Riley says that she thinks that we need a virtual town hall meeting moderated by a third party where the public can submit questions and then vote. Now, there are a variety of different forms for polling and voting. I know that in our very first series, we had Stratton Hatfield of Recount, right? So he developed a platform, recount.bm, where people can register and log in. It's connected to your voter ID, and you can vote on certain issues. Now, on the other hand, you have people like us. The aim of this series was to spark a community forum and a community conversation. So I think as long as we're raising these, it may not be for us to be the final arbiters and the final party to decide, but I appreciate that you and I can go back and forth and debate this. So the takeaway for this, which ties into what Dr. Dowling was saying, is that when we make these legislative changes, we have to be mindful that the premier may very well be making the right decision based on the right advice, but that has to align with the sentiments of the people on the ground. And we have to be able to question openly and receive answers when we're not quite sure what the justification for a decision might be.
No, absolutely. Absolutely. So I don't know, with respect to the third question that was asked, it was with respect to, again, following up on something we covered in our first series, and that's to do with respect to the access of internet. And I missed one word, and as you know, in law, one word is very important. And the word that I missed was affordable. I had simply asked the premier, the access, is the government looking to give Bermudians access, and are they prepared to make legislative change to ensure that all Bermudians have equal access to internet? The word that I missed was affordable, Ryan, and I don't know if you want to share some thoughts on that. And perhaps I can go back and ask that question with respect to affordability. But I think the premier's response was simply that the government have been in touch with the regulatory authority and the service providers, and if they don't make provisions to work with the general public, then the government is prepared to legislate.
Right.
But
well,
go ahead.
So on our very first installment of this particular series, we had Sierra Burrows on as a guest. She is a law student currently in the UK. And one of the big questions that she had in response to this pandemic was the need for internet and internet access at that. So as we all know, with the shelter in place regulations, a lot of people have been confined to their homes. You have students that are now being forced to study from home. You have people that are working from home. You had homeless people who maybe were not getting access to government updates because they don't have internet, they don't have mobile devices. And now, as a lot of people's paychecks are being cut and people are being furloughed, internet is going to be a real problem, especially if, as government has stated, we're going to be back and forth between different phases as far as being confined to our homes and going out into the street. So the question there was, how much do we value internet and data, and how we are able to access information? I mean, with the press conferences, government and the people at home have been limited to watching these press conferences on the internet. And that has been the only form of us hearing from our government over the past month and a half. You know, we can't just show up to a town hall meeting. We can't go knock on the MP's door. We can't show up at the House of Assembly. And so really, I mean, imagine people that are sitting at home right now without internet access, or indeed people that don't have homes. How are people getting information? How are people communicating and functioning? And so the question that you asked, Aaron, revolved around internet access. Now, the Premier said that there were being tools made, for example, for students in the education system. Packets were being sent home if they didn't have internet, and that others were being donated with laptops and things like that. However, the key word, as you said, was affordable. Internet access is one thing. He mentioned that Bermuda has one of the highest rates in the world for people using the internet, but there's been a lot of complaints about the reliability of internet as well as its affordability. And so I think, Aaron, we may have to very well look into, for some of our future series, talking with somebody in the regulatory sector or something like that to see what exactly can be done about being better, providing better access to the internet for a lot of people right now who are stuck at home and don't have those opportunities.
No, absolutely. And I think as we wind down, I think we've had a fairly good session, just over an hour, nearly an hour and a half. Thank you again to our guests. But I think particularly, Ryan, it's important at this juncture as we're moving into post-shelter in place to just give that encouragement to members of the community that it's not easy. We get it. We want to be out and about. We want to partake in activities that we ordinarily would as young men in the summertime. Our friends are back, but just to be careful, you know, to guide yourself with a bit of caution, precaution rather, but not a hysteria, if you will. I know that a few times during this exchange, I've needed to cough, and I've held it back in a strong. Next it'll be, me on the meme, coughing there. Aaron's got to get tested. But again, speaking on the issue of tests, I think that the government have done a great job with respect to the amount of tests that it's been able to do over the past few days, a few weeks, particularly as Dr. Weldon has led the team out there at Southside. I know some issues, Ryan, that were discussed were emergency workers having to travel all the way to Southside just to get tested. As we wrap up, what are your thoughts on that?
I mean, ultimately, I think we have to be practical, right? I mean, there's only so many places that you can use for testing facilities. This is a very fast-moving situation. A lot of this is just government scrambling to put out fires. I can only imagine what they do all day, every day. They don't have the time for, I would hope that they're at least making reasonable and balanced considerations, but I'm mindful of the fact that they don't necessarily have the time to sit and talk with us like how we're talking and consider every single factor. That's where I think, like what Dr. Dowling said, the key is to collaborate and have as many experts as possible and talking, because government may very well say, look, this is the only facility we have, and this is where we need to put people, and it's going to have to be at Southside. But you may very well have somebody out there in the private sector who's willing to lend a hand or offer up a facility. And I think that's where we may need to see a little bit more from government. Now, they've implemented a forum website for people to give feedback, but we don't exactly know what's happening with that feedback. We aren't seeing any debates around the suggestions that are being made. It's sort of just a submission. People can go online and submit an idea, and it just sort of seems like it may just get sent out into the abyss. You don't know what happens. It's like writing a letter to Santa Claus. You don't know exactly what's going to come of it, and there's no critical discussion. So, I mean, I know I've dodged around your question a little bit, but I think the key is that we have to just be mindful that it's a rapidly moving situation, and the more people in the room that are debating and talking, the more willing we are to engage with people and be criticized and be held accountable, the better the outcome will be for all of us.
And in saying that, Ryan, I want to ask our viewers to consider this as we close. I'm going to ask you for a provisional view, and we'll follow up during the course of our next series. But with respect to, we've heard from doctors. I think there's a view amongst the community that when you get into these professions, you are paid well, and therefore you can afford breaks like this. We've heard firsthand from these doctors that affordability is an issue right now. They're having to take out loans and the like. Now, I have a question. We've discussed it, but this is for our viewers to consider. Should the government take a pay cut? Should the government, particularly, and I'm referring to cabinet at this moment, not with respect to civil service, but that can be considered because we've heard comments from former members of parliament in that regard. But should the cabinet take a pay cut? You've got two sides of the coin. One, they're leading the charge in that global pandemic. They're having to work harder than ever before. On the flip side of that coin, you've got the consideration that everybody's taking cuts during this time. Everybody's income's being slashed, and perhaps they should lead by example. What do you think? I want to leave that with our viewers. I'm going to ask you very briefly, and I'll let you wrap up.
Yeah, I mean,
I want an answer, Ryan, because I asked you these questions, and you say that.
Are we going to get an answer from you too? Because
no, absolutely. I think
because you've been asking all the tough questions, but
Sure. Well, I'll give my view on it, and then I'll lean it to you. I think that the government should take a pay cut. Now, the size of that pay cut, maybe it's just a token to say, well, maybe it's not a drastic one, because I do think that they deserve a lot of credit for having to work extremely hard. If this was the private sector, they would their compensation perhaps wouldn't change with respect to the amount of work that they've got to do. They need to be compensated. They have families. They have obligations. I do think as a symbol of showing and demonstrating to the public that they are prepared to take a cut, they should. Now, I'm not going to make any particular comment as how much that cut should be. I think that's a totally separate discussion, but I think as a symbolism and a show of solidarity to the community where we're all taking cuts, they should take a pay cut. Now, that's my tough answer, or that's my answer to the
That's
tough.
Not a tough answer. It's very hard to disagree with you when you lay out your analysis like that. And so what I will say is this, right? Premier David Bryant was asked this question prior, and his answer was, we're not going to give an answer on that right now because the finance minister is going and making considerations and doing all sorts of things, and then we'll see. Here's where I think the government, in which circumstances they should take a pay cut. I don't think they should take a pay cut just to placate the people. I don't think it should just be done just because everybody's calling for it. People have called for government ministers to take pay cuts long in advance of this. We've seen it, that's something that around the world is always going to be an issue. People say, they're getting paid too much to just sit up there and do nothing. So people are always going to say, yes, they need to take a pay cut. But I think we have to balance that, right? When you look at some of the salaries of some of the Quengo leaders, so when you look at like the Tourism Authority and all sorts of other avenues in government, those people get paid far more than our government ministers. I mean, government ministers currently in Bermuda make what, 100,000 to 200,000.
Ryan, I'm looking into my screen for your answer. I don't.
I'm giving you a little bit of background. I think I'll put it this way, and I think it's important because it's not just as simple as saying yes or no. I think there are arguments on both sides. But here's what I think government should do. I'm going to give you an answer. I think that when you look at this situation, Premier Bryant has indicated, right, last night, he said, this is going to be an unprecedented situation, and we're going to have to do a lot of things differently that we haven't done before. Some people were calling not only for government to take pay cuts, but for the civil service to take pay cuts. And I think if civil service pay cuts are coming, which they probably are in some sort of way or some sort of method, the government and the cabinet members are going to have to lead by example. And that's something that Ciara Barrows, our last guest at the first show, said. So, BTA, for example, as a Quengo, took a pay cut. And I think that was a very noble step and a good example. But at the same time, you do have to pay for people's, qualifications. So what I would say is the key here to manage is that Premier Bryant and the rest of his cabinet are going to have to inspire the rest of the people. They can't just manage this situation and make arbitrary cuts, but they're going to have to lead from the top. They're going to have to show to us that we're all in this together. And I do think that a part of that may be taking pay cuts, but I don't think it should be pay cuts alone. I think that they have to set an example and use it as the impetus to inspire everybody to sacrifice and make small changes where they can. So I hope that makes sense. I don't want to just, and I think it's important to say that because I don't want to just jump on the train of saying those guys get paid too much. We need to, they need to start and lead. It's not like that. It's not from a place of vitriol or they're not effective. It's generally from a place of we're all in this together. And if everybody is suffering, we may all have to do so too. And that means we may have to give up some of our personal comforts. So I'm mindful of the fact that, we have to pay for people's.
Is this a yes with a lowercase y?
It's a yes, but it's only a yes if they do it in the right way. And that's what I'm trying to say here, because no decision is isolated. You can't just say yes or no. If they said no and they laid the reasons, I think there's an argument for that too. So that's why I say it's not just saying yes or no, but you have to attach a wider program to it. that does it in a way where it's empowering the people, it's inspiring the people, and it's having a knockoff effect, which allows us to make some other big decisions, which I do think we'll have to talk about in other series. Are you happy with that answer?
Well, we'll let the people decide.
Yeah,
and let
exactly. Okay.
We'll continue as we continue to go on. But I think we've had a great discussion. We're reaching the hour-and-a-half mark now. I want to thank the listening public for their feedback, their contribution. We've seen, with respect to a comment, I will end on this note. I see a comment here from Miss Kamika Jackson where she says, "Where's the balance? Those pay cuts that you implement for civil servants can very well create other stimulus bills through some type of government subsidy." I think that's a good question, a good comment to end on as we ask our public to consider it. We promise that during our next series, we'll re-engage in this discussion and let's see where it flows. Hopefully some of our public officials are listening and maybe we'll see something forthcoming. But Ryan, I want to thank you for your time. I appreciate it. It looks like Saturday we may be able to link up finally and say hello. I haven't seen you since you've been back. But yeah, man, we appreciate your time. Thank you for the listening public. And with that being said, we'll see you next Tuesday.
And thank you, Burnous.